This is Sherman J. Silber, M.D. We should say that Dr. Silber is a world-recognized microsurgeon who, you may have read, successfully oversaw the procedure that transplanted a testicle from one identical twin to his brother, who was born without testicles. Subsequent to the transplant, the receiving brother had a baby. The male, from infancy to old age. Dr. Silber is our guest, and we hope you'll join us. That we showed earlier of the inside of the penis. Yes. Hello.
Hi. Okay. Why, if a baby is born, normal boy and everything, where do they get the urge to start wearing makeup and stuff when they become 18 or 19 years old?
Well, basically, during those first 18 months, you shouldn't be self-conscious and wondering if you're treating your girl like a girl or your boy like a boy. That's not a problem, really. As long as you recognize that your girl baby is a girl and your boy baby is a boy, he or she will be receiving the most complex messages from you that you can't help but transmit that tell him or her what he is.
And most of which we don't even know we're giving.
Oh, we don't know we're giving them. But you know that when your kid is 18 months old, suddenly he is clearly, or she is clearly showing signs of gender differentiation. It's when their language begins to form, when they begin to start using words, that identity is forming. And that core identity, associated with that core identity, is their name and what sex they are. And eventually that transmits later into life into behavior that is either coded female or male.
In your book, you talk about male impotence, and this is obviously not so funny to the untold numbers of couples who are sustaining it. If the male is having trouble becoming erect, the first thing you want to know is whether or not it's up here or down there. Is there a urological explanation for it? And in your book, you say that one of the ways to check if he's okay physically, first of all, you say that men have how many erections a night?
Right. All men would have 5 normal, firm erections lasting about a half an hour every night while they sleep at 90-minute intervals. You know, it's... Can you
imagine that? Is it any wonder we're tired in the morning? So, obviously, an involuntary something. Is this accompanied by erotic imagery in our dream? Or
it really isn't, because we've wakened men during various times when they've had their erections. It's always during what's called REM sleep, or rapid eye movement sleep. But it's just a diffuse phenomenon. It has nothing to do with erotic interest. They could be dreaming anything and have this erection that lasts a half an hour. It's not erotic, but it proves that in that man, his physiology is intact.
Right. Now, if a man then is having problems becoming erect at conscious moments when he wants to, obviously, Dr. Silber or anybody who's checking, any urologist, would like to know, is he having erections during his sleep? If he's having erections during his sleep, hey, that gives us a lot of information. How do you suppose we find out? Do you have any idea? No, I mean, without waking the guy up 5 times a night. Listen to this.
All you have to do, there's complicated ways with strain gauges and electrodes and machines, but there's a much simpler way that anybody can perform. Take a little roll of stamps, usually about 5 stamps, maybe 4, depending upon...
Postage stamps.
Postage stamps, right. And I'm really serious about this. Just wrap it around the penis, and you can just attach it at the end where they connect with a little Scotch tape. And have it not too tight, but firm. And when he gets that erection, it will bust the stamps along the perforation. If he wakes up in the morning and he just finds the stamps are torn anywhere, then he probably rolled over in his sleep and he just accidentally tore it off. But if you see a neat, tear along the perforation or one of the perforations, and it's lying in his bed neatly cut along the perforations, that means that he had a good enough, firm enough erection to support intercourse.
We finally found some good from the post office. You think of, but you know, while you're, I'll tell you what is not so funny is the number of misguided diagnoses, money's being spent, pills, shots, when all you needed was a couple of airmail stamps. I mean, it isn't that that's all you needed, it's just that think about the information that the doctor gets with this simple kind of, that just knocked me out, the stamp test. We're with Sherman Silber, MD, and we'll be back in a moment. Dr. Silber's book is titled The Male, simply enough, From Infancy to Old Age. You should know that Dr. Silber is the author of How to Get Pregnant, a book which was very useful to many people wanting to know who want babies and so on. And it also told you a lot about contraception as well.
Hi, how are you today?
Good morning.
I was just wondering if a vasectomy is performed, what are the chances of a woman getting pregnant after it's been reversed?
Oh,
It's been reversed.
Yes.
okay, well, it depends upon how it's done. The vas is a very, very delicate, tiny little structure on the inside, though it's very rugged on the outside. So vasectomy is easy. Putting it together is hard. Furthermore, the pressure buildup from vasectomy, you may not be aware of, causes all the ducts close to the testicle to blow up in size and get little explosions. And you've got to bypass those areas of blowouts with very delicate microsurgery. If it's done right, 90% successful.
Is the caller there? Hi.
Yes, Dr. Silber. My husband has a varicose vein in his left testicle. We have a 2-year-old child, and we had absolutely no trouble getting pregnant. As a matter of fact, she was a mistake. But I can't get pregnant now.
Okay.
We've been trying about 6 months, and I'm wondering if this varicose vein could get worse with time, and if he's...
Not much time. Dr. Silber commenting.
Varicose vein, if it's causing your husband to have a low sperm count, should be operated on. But most men with varicose veins have normal sperm counts, and I wouldn't run into a knife-happy situation, especially since you got pregnant easily the last time.
So what should she do first?
I think there are too many varicocelectomies being performed on men who maybe don't even have a varicocele, but the doctor thinks they have one. And certainly men, 15% of all men, anybody listening there, 15% of you, if you stand up, you feel your left testicle, you'll feel something that feels like some worms in there, you've got a testicle. It's that, you've got a varicocele. It's that common. So don't necessarily get it operated on because most of those men are fertile.
What should she do that's cheap and not involving OR and all that?
He needs to get a sperm count, several sperm counts done, and learn more about infertility before you rush into surgery.
Thank you.
Hi, Dr. Silber on the line.
Yes, Dr. Silber, what I'd like to know is exactly what happens when a man gets a vasectomy, and what are the ill effects, if any, mentally or physically?
Well, no hormonal effects. We've proved that. But there is a pressure buildup always in a very delicate ductwork called the epididymis, hard to even pronounce. But this is a 20-foot-long tube that conveys sperm from the testicle into the vas deferens. It's 1/1000th of an inch in wall thickness, 1/300th of an inch in diameter, 1/3 the diameter of a pinpoint, extraordinarily delicate, and this really blows up like a balloon, and it's okay. It's not harmful to his whole body, so to speak, but he gets these little blowouts in there which have to be bypassed if vasectomy can be reversed.
But that's not a concern of somebody who wants a vasectomy.
That's right. In terms of their health, vasectomy should have no long-term effects on his health, at least according to all of the really careful prospective studies we now have. I think that most of the scare tales were just tales.
You're married?
Yes, I am.
How many kids?
2.
And you'd like him to get one?
We're thinking about it very seriously.
Yeah, and you want to know what's going to happen as he goes.
Right. He's scared about it. I'm scared about it because we're still fairly young, but we're running out of birth control methods right now.
And you're anxious about that.
Right. Right. We just don't know what to do anymore.
So you're saying there is no reason for libido to be diminished, or for?
No, the only thing that would diminish libido is if he has this fear of vasectomy and he's scared that in some sense he's lost his manhood. But otherwise, no physical reason.
Now, when you cut the vas deferens, as you call it, It sounds like the testicles are left there, you know, kind of all by themselves in a sac there without any connection to the rest of the body.
Well, not true. You see, the blood vessels which keep the testicle alive and which bring the hormone back. See, he's got to have male hormone testosterone to support his libido. That's true. Vasectomy doesn't interfere with that unless it's performed incorrectly. But normally, vasectomy won't interfere with that at all. It just keeps the sperm from getting out. The hormones are still released.
Thanks for calling.